Okay. You ready? Okay.
Good morning, everyone. As you can see, I'm here with my colleague, the Honorable Susan Jackson, and I will start by talking about the budget for health yesterday. Yesterday, I was honored to have the opportunity to give a reply on behalf of the One Bermuda Alliance on the second largest ministry in government, the Ministry of Health. And I make that point because it would be the largest, but we have $130 million of debt financing in another ministry. It is, to me, the engine room of the cabinet, simply because healthcare is critical to all of us, and the hospital falls within that ministry. There were many points that I raised, but today I want to focus in with you three critical areas that this government must do better on, and up to this point, they're failing on. First off, poor budgeting. If you take a look at the budget book like we have, over the past 3 years, the PLP has been over budget. In other words, had to give more money through the fiscal year. In 2021, 2022, they were 9 million short, they had to pay up. In 2021, it was 9 million. In 21-22, it was 27 million. And this current financial year, which ends at the end of this month, it's 18.5 million. Simply unacceptable. In 2020, you could understand it with COVID hitting us. But in the end of 2021 and 22, there's no excuse for being so short on a budget and have to come up on it. They failed on that. The second thing that's important is the National Health Plan and universal health care. I think members of the public are well aware that it was about 2010 when a former minister of the PLP first introduced the idea of a national health plan, which meant universal health care, access to it by everyone, and lowering premiums, making healthcare more affordable. Well, here we are now in 2023, and they haven't progressed it much. I was polite yesterday when I said they've stuttered and they've staggered on it. But now we see yesterday they created an Office of Program Management to oversee further implementation of it. And that's coupled with the fact that the Bermuda Health Council also has some responsibility. And the Health Council budget went up by $1.2 million last year. So we've created a new department to push through a plan that the PLP up to this date has been incapable of doing. And the real concern is they haven't said how we're gonna pay for it, who's gonna pay for it, or if there'll be new taxes. So the talk is cheap, they need delivery. The second thing I talked about yesterday was hospital finances. And let me make it clear to everyone in Bermuda that the OBA fully supports the hospital, the quality of care and the service they give generally down there, first class. But the PLP government has once again messed up on the hospital budget. If you look at the last 2 years, they had to fund them extra money, significant amounts of extra money. This current financial year, out of the blue, the Minister of Health says that 15 million extra had to be funded to the hospital. And then we hear one of the most unusual and strange press conferences last week by the minister was because we had a 32 million shortage in the block grant that we have to give them. No explanation how or why. 32 million over 4 years was simply forgotten by the government or not checked in by the hospital. And we care for our people? Something's wrong here. Questions need to be answered as to why this grant fell through the cracks. Now, the other thing I think is worth noticing with the hospital is that in 2018, the PLP changed the funding for the hospital with a block grant for $322 million from the Mutual Reinsurance Fund and then funding from government budget. Since that time, they have not gotten the hospital budget correct. Now, I think that is for two reasons. One is a lack of an oversight, but secondly, and more importantly, as I raised in the debate yesterday, once you give somebody a block grant to do anything, you take away their incentive to actually do better. The hospital, in my words, is turning away revenue they could earn quite easily by having all the operating theaters open, by having elective surgeries done. There are a backlog of elective surgeries that haven't been scheduled and can't be done. Don't take my word if you don't want to. Speak to the doctors themselves, whether it's hip, whether it's knee, whether it's eye. There are many surgeries we are turning away, sending other places. That's revenue the hospital can earn to get the money. Additionally, we cannot forget the debt that the hospital owes on this secret deal that the PLP did when we built the acute care wing. And they want to complain about the airport. But here's something that most people in the public don't know, is until 2044, the taxpayer is on the hook for $42 million a year in debt payments in 3 different areas. 2 of them to the company who built it, and 1 of them for yearly contractual obligations that they have. So when you put all of this together, you realize we've got serious financial issues to our only hospital that we need to support. And the last 2 things I'll say about the gravity of this situation is, when the OBA was in power, we left them with close to a hospital with close to $100 million in reserves. In fact, reserves were so high that the finance minister in one budget said, dwindle them down, that's way too much cash sitting around. I think the amount went to about 75 million. But in a short period of time, the PLP, under their leadership in finance in that way, we see in the budget yesterday that the reserves are depleted. That's scary. That's certainly very scary. And to raise concerns even further is we cannot even see updated financial reporting for the hospital. 2018, the minister says, will be tabled soon. 2018, not last year, the year before. We're 5 years delayed. And let no one assume that I'm saying this because I'm worried about how the finances are handled. When we go to the House on the Hill to discuss budgets, we're expected to have real-time information to do it in an appropriate way. And it's unacceptable that those reports are late, and it's the minister's responsibility and this government's responsibility to ensure that's the case. So having said that, I've given you a quick overview of a very important ministry, and I will turn it over to my honorable colleague, and then at that time we'll take some questions from you. So just allow me a minute to take my papers out of the way. My colleague.
Thank you.